So thanks everyone for joining. Margaret and I are both avid soccer fans, and we'd like you all not to tell us what's happening during the game if you happen to have it on somewhere else. Welcome. I'd like to welcome everyone to our town hall today, presented by the Implementation Science and Health Systems Core at CAPS, of which Margaret is a member. I think just before we get started, I'd like to suggest that we hold questions until the end, unless there's like a burning question, and you can put it into the chat. Dr. Margaret Handley is a UCSF professor of epidemiology and biostatistics and medicine. She's been a leading light at UCSF's Implementation Sciences program, including directing several training programs here and abroad, and also establishing the PRISE Center, which is the Partnerships for Research and Implementation Science for Equity, where she's the co-director. Dr. Handley is recognized as a leader in the application of implementation science methods to improving health outcomes for populations that experience disproportionate burden of illness, but also towards solving real-world problems. So most recently, she's expanded her research program to applying implementation science towards developing effective interventions to combat climate change. And she's doing that as part of a Fulbright Award in Croatia right now, but she is back in the States long enough to give this talk. And so with that, I will hand it over to Margaret to tell us about designing for equity.
All right, thank you very much, Sheri, for that introduction, and everyone for attending. And I just want to start by saying I really appreciate the opportunity to present to this group and sort of bring forward some hopefully inspiring ideas. I think this is a really exciting area of research, and I hope that I convey in my talk that a lot of people are really approaching this in some new exciting ways. And I think it might be a really great thing to have a follow-up series on if you all find it that compelling. So I will go ahead and get started. So I want to talk a little bit just about, I know some of you are not that familiar with implementation science. I'll talk about a few principles, and then I'm going to dive into some of the ways that implementation science can help improve equity and try to give examples of methods in this space in particular, something that I'm really excited there's a lot of new work in. So how do we define implementation science? If we think about it, it's a lot of things we already do in a lot of work where we work in the intervention space. And it's really the process of putting to use or integrating new practices, such as evidence-based health interventions within a setting. So it's the practice of intervention work, often in public health or clinical settings. And when people kind of put this into the science language, they talk about it as the scientific study of the use of strategies to adopt and integrate those evidence-based interventions into clinical and community settings, all with the goals of improving patient outcomes and benefits to population health. So this is a slide I like. It sort of gives us a little bit of language that I think is useful. And I think, we often start with the interventions that we're interested in. Maybe it's a practice, it's innovation. Maybe we're making something. Maybe it's not evidence-based yet and we're working on it. That's kind of the thing that we tend to spend a lot of time talking about. And then we convey our interest in that by doing effectiveness research that looks at whether or not that thing works. So this is kind of the standard approach that is done with research methods. And then when you start to add on implementation research, you're really trying to understand how best to help people and places do that thing, try to adopt it, try to spread it, try to have it be equitable. So there's a lot of the reasons why people do implementation research is to understand that thing that they're very interested in, which is the intervention or program. And we often use different strategies and try to study different strategies. Is one-on-one counseling more effective than group counseling? Those are strategies to try to help people do the thing better. So we don't usually just put it out there in one particular way. We're often trying to understand different delivery strategies. So when you think about what the implementation outcomes are from that kind of work, and you're trying to look more at how that thing is getting put into practice, you might be interested in how much it was adopted, how well it was adopted in different types of measures. And so that's where there's a lot of interest in looking at implementation measures, even if that's not the focus of your work. So we need implementation science. I think we can all agree there's persistent evidence practice gaps that can be made worse by poor implementation. So if we're implementing something with the idea that it's going to make things better, we should study as to whether or not that is true. We generate evidence that needs to be put into practice equitably and sustainably, and we don't often know how to do that. We don't always know what the best evidence is, and this is a point I'm going to talk about a fair bit, and who should be creating it to address pervasive inequities. And we want to replicate success and avoid failure. So these are all some of the drivers as to why people get involved in implementation science in the first place. So I'm just going to say a couple things about these with a little bit more detail. What we often start with is this idea of an evidence practice gap. There's something usually known to be effective, and it's not in routine practice. So people often talk about this from things in clinical care, where all the research is really focused on breakthrough, and there's no follow through to make sure that people are closing that evidence practice gap. So there's lots of innovations, but they're not actually brought into the settings where people would benefit from them. So a lot of reasons why we get involved in health equity work and implementation science is because we're drawn to closing this gap, this evidence practice gap, or we think there's not evidence for something that is important. Another reason why we really need implementation science is that we, like I said, we generate evidence. We don't know what to do with it. We don't know where to take it. We don't know how to sustain it. So there is a lot of research and implementation science that's on things like sustainability or spread, on cost-effective approaches. So these are things where we don't have, unless we try to have the skill set to really understand how to best take evidence we generate and move it forward and match it to setting and situation. Another one that is sort of touching on this idea, I'll talk about participatory work, is that we often think we're starting with the best evidence, but we didn't necessarily do the work of engaging with stakeholders around what does evidence mean in the setting that we're interested in working in. And so this is a picture of a peanut grinder making peanut butter that an innovations group developed to bring to women who had a very large household burden in West Africa of chores and food preparation. They thought this would help. But this is actually a grinder, and they found that when they brought it to the setting they were in, people didn't make things with peanut butter. They actually made things with whole peanuts, and they needed a peanut sheller. So this is the kind of thing where we might think, oh, we wouldn't do that. We wouldn't design an intervention in a vacuum, in a void like that. But we do it all the time. And I've taught many classes with well-intentioned students who are like, I'm going to make an app to do X, I'm going to do this to do that. And they've already sort of decided on the intervention. And that's just the way we're sort of trained. And so this helps us maybe back up a little bit and think through how can we have a process to really determine what is the best evidence. And we also want to learn what happened, and we don't want to wait till the end of the study. So we might wait for part of the study to be done, but really understanding what implementation looked like during the time that an intervention or program was put into place is really critical. And otherwise you end up with this, oh, we did the study and this is what happened, and now we're trying to go back and disentangle. And we sort of joke about this. It seemed like a good idea at the time, but we want to actually be more forward intentional with our work. So those are all good reasons. So reaching people for whom they're intended with interventions, being implemented safely, efficiently, equitably. And then I think this point, the third one, is what we'll spend more time on, is really working on how can we co-develop and co-implement in a more equitable and relevant way. Some of the main principles that kind of come across a lot of the implementation science programs, and I think in the training program here at UCSF, really working around stakeholder engagement, this tackling real world gaps, collaboration in design, using theories and frameworks, and improving, hopefully, the outcomes and generalizable knowledge as a result. So now I'm going to sort of pivot to implementation science and health equity. And I think, the focus on advancing health equity and eliminating health disparities needs to be a goal of implementation science. And I think there's been an explosion of commentaries and other work in this area, really talking about how implementation science has sort of taken a stand in a way of being agnostic to a lot of drivers of inequity, and sort of the all boats will rise kind of approach by making more efficient interventions more equitably implemented doesn't address all of the inequities. So I think there's a lot more interest, and I'll just sort of call out here, there's people who've been in our research and implementation science for equity training program who've written some really great work on this. That's the Galavis article, and colleagues here at UCSF like Dr. Andrew Kirchhoff. So I'll just call out a few of these, but there's going to be a resource list also associated with this lecture, so you can access a lot of things that are coming up here. So I'm going to spend some time kind of with these tables that are really helping maybe to operationalize how we might think about one way of looking at some of these ideas of how would we bring an equity question into our effectiveness research, just to sort of get you over to the place where you can see that. is an easy extension of the work you do. So taking the area of, for example, something that we worked on during COVID, do telehealth reminders increase vaccination rates? So that's a good effectiveness question. And then the equity question that focuses on implementation is which types of telehealth reminders, so for example, which strategies for COVID-19 vaccination are most acceptable to patients with limited English proficiency. So that would be taking sort of a variety of new angles on that effectiveness question. And another project that was something I was involved in was about offering on-site rapid COVID testing in shelters for the unhoused. Would that approach reduce outbreaks of COVID for staff and for people who were residents? And so another way of looking at that, does offering that on-site rapid testing reach higher risk residents, or are higher risk residents less likely to get tested, and therefore it's increasing a disparity? So I think the idea of work having not just the assumption that we will be moving in the equitable direction, but also looking to see if the work we're doing could potentially increase the disparities is an important way of thinking about this. I'm going to dig in deeper now and talk about sort of what I think of as sort of two ways equity can drive implementation work, and give examples about how people can do that. And the first one is really, I think what a lot of people already have come to do is that equity considerations are integrated into the design, the implementation, and evaluation of projects. So I have a lot of specific examples I'm going to talk about how that method can be applied in your work. Then I'm going to talk a little bit more what I consider sort of this more new space challenging a lot of research that's currently how we have sort of business as usual. And in this case, I'm going to frame it around equity driving the research approach for everything, to all aspects of the project. And this is true in a larger sense than just implementation science, but I'm going to talk about it in the context of implementation science. So I'm going to dig into these here. Okay, so this first one about integrating. So in this one, if you think about, I just picked a bunch of different method approaches that are sort of general things that we might do, and then how a strategy might sort of operationalize that, and then give an example that is equity focused. So I have a few slides that are in this structure. So a lot of people do is we try to really understand through multi-level analysis, augmented data, modeling, how do we really understand how disparity is driving intervention uptake. So this is where we might have modeling and simulations to really understand, for example, in complex health systems, how certain screening procedures, certain algorithms, that are perhaps racially driven will perhaps increase a disparity. So we can model decision-making ideas before they are put into place. And so this is sort of a modeling approach that can really be done to sort of anticipate potential areas of concern. That also can be complemented with augmented data to actually understand maybe some things that might be important decision-making points in more detail. So this is just kind of taking like the more epi policy analysis approach and really trying to understand larger context and complexity of things, and not just pushing that to the side. Another one is, I think, what a lot of people here are really familiar with and do amazing work in, is the idea of working on participatory approaches to design the intervention. So this can be a co-design process with partners. It could be a stakeholder engagement process to make sure things that are developed are resonant and look that they would be acceptable. But you can also take this to really working with partners to design equity measures. So how did the community engagement go from the perspective of partners? And are there ways of looking at that that are not so maybe checklist based and a little bit more focused on engagement and equity indicators? So there's examples here where designing interventions that are meant to address historical inequalities, like discrimination in healthcare, housing access. Things I've gotten interested in doing are participatory data analysis with stakeholder groups to sort of look at interpretations from a variety of lenses. Thinking a little bit more about not only sort of intervention early on, but really thinking about the implementation design in a stakeholder process. And then using some of the frameworks of implementation science like REAIM and CFIR with co-developed measures that might be specific to a situation. Another approach that I think is really exciting too, because I'm an epidemiologist, is building equity into the design. So this is like the study design. So this is the kinds of examples would be things like multi-level designs, where you might have designs that are targeting more than one area. And so you might not only have like individual level outcomes that you measure. I'm very interested in community-based preference designs, as several of you know, because that's where you can either randomize people to choosing between interventions, or you can right up front offer people the option of having a preference for a specific intervention versus actually getting randomized to that choice being made by the researchers. So that's, I think, really interesting. And then these new designs, relatively new, I guess they're not really new anymore. I keep saying they're new, but they're new to me in the last few years, are these like the most design is an optimization design. It's a factorial design. And I'm going to give an example of that in more detail. And then the smart design is a sequential design where there's decision points where if you find perhaps uptake is inequitable, you can randomize and try to fix it with a different intervention component. So these are a couple of study designs that I think are really worth thinking through if you have flexibility in what you're going to be doing for your study design. And then the fourth one too, I think is something that people are also readily doing, is building equity into measures, into the evaluation. So there are increasingly metrics that are specific to equity. There's equity frameworks that people are integrating that have their own measures that can be brought and incorporated in a multidisciplinary way into your conceptual approach to making an evaluation plan. And then people are adding specifically equity to implementation frameworks. So this is, for example, you could be looking at equity-based reach, adoption, fidelity, acceptability, sustainability. And I had to say that one of the things got me really interested early on in implementation science was I was very interested in reach and in uptake by language. And so language could coordinate interventions that we were offering in the safety net system. We were very curious to see, did we disproportionately, like positively impact Cantonese speakers' engagement with a diabetes program because we offered language concording health coaching, or did the fact that we spent all these resources somehow take away and there would be an inequitable uptake? And so there's something that got me very interested in ideas of maybe more granular assessments that really looked at some of the drivers of inequity. Then there's also sort of, as we move through the research process, building equity into health promotion and dissemination. So this, I think, is where a lot of times there's not a built-in timeline to do this work. So how can you develop messages about programs? How can you take findings with community representatives or stakeholder engagement so that those messages don't just reflect the results that the community helped develop, but actually reflect the views of the community or are framed in areas of politics and engagement that are different than what a researcher might be generally comfortable with. So how can we move that kind of approach forward? So something I think is a really interesting area around dissemination research and the idea in social network spaces of really understanding how to bring a different perspective into the way we disseminate. So I'm going to give a couple of examples that I think get into this space a little bit more. I don't know if anybody from our RISE alumni group, the standard, they all, our RISE groups have given themselves nicknames, and this by Carla Galaviz and her colleagues. Early on in the pandemic, they wanted to write a sort of like a piece advising on how to use implementation science to address emerging disparities during the pandemic. And so they put together this nice paper that I would encourage you to look at. And it touches on some of the things that I was talking about because I read their paper and I incorporated into the presentation. The idea of moving more to really understand the disparity. So this is sort of the first one here, quantifying and understanding disparities, sort of clarifying the drivers of disparities. Really using that information to design more equitable interventions. So these are all interlinked, as you can see by the arrows. And then being able to take the vantage point that there might need to be different approaches than what we typically might do that we wanted to implement to address COVID disparities. So these are the kind of things that needed to be thought through in order to improve, for example, vaccine take. So designing equitable interventions with participatory approaches. And then I think the idea of thinking about like some of the different kinds of study designs and some of the iterative work around design, but also the idea of trying to accelerate the pace of research by using different kinds of design. So I think these are some of the ways, if you look through this, they've sort of highlighted. So that's an example that I think from COVID that we all know didn't perhaps get adopted to this level, but this is an area where I think there's been some really good thinking around how to improve implementation science in reaction to things like a pandemic. Another area, this is getting at the designing equitable interventions with participatory approaches in a very concrete way. I know many of you are familiar with the sort of framework for implementation science called the behavior change wheel and the COMBI model, which helps sort of map out barriers and enablers to things that might improve behavior for an intervention. And then there's a process where you might have gone through and developed a bunch of different potential intervention components, and how do you rank them and prioritize them? So this is a criteria that you apply to decide which intervention components you want to include. Usually you can't include everything. And I think what this is really sort of highlighting here is that equity, of course, is one of them. That's what the E for appease stands for. But I think the idea that this decision-making about acceptability and practicability can be done in a participatory way. It can either be done with community advisory boards, it could be done with stakeholder engagement. There's a lot of different approaches to how this decision-making step, which often maybe the stakeholder engagement is in the development of the ideas. The interviews and analysis gets done sort of differently by usually researchers, and then this process is applied. So I'm just making sort of the point that this process can be done in a community collaboration. And then this is just an example. I'm going to talk through a research paper that I think is really interesting, building equity into the design using this multi-phase optimization strategy implementation trial design, which is really giving you a chance at, it's really like a pre-study, formative work, but it is considered a study design in that you are identifying components and a rationale for an intervention, but you don't necessarily know which ones should be included, kind of getting to that point I was making about the appease criteria. You might pick ones that are very expensive or less expensive, hard to implement, and they may be things that you want to try out. Which of these do I really need to include? So as people have tried to move towards more multi-level intervention work, at the same time, you then want to optimize which components do we really need to have to be multi-level or to have multiple intervention components. So this builds in basically a factorial design phase where different sequences of intervention components or different combinations of intervention components, different doses of intervention components are put through this optimization phase, which happens before you actually do your trial, so that you've sort of maximized like which are the most likely to succeed based on criteria that you set. And they're not always like criteria of uptake, they might be criteria of are you addressing inequity by offering that particular component. So certain participants are engaging who you might really feel are important for you to reach. So this is a study that is by a group that is looking at trying to address alcohol and illicit drug use. They're using, this is from a protocol paper, factorial design to select components. And the way they are approaching the selection of the components is to use a participatory research approach and a community advisory board. So this is in New Jersey, and it's among men with alcohol and illicit drug use disorder plus criminal justice history, so pretty high risk population. And I put the aims in here just so you get a sense of how people would write this. I'm sure this came directly from their grant proposal, but they want to use this efficient experimental design to estimate the unique contribution of candidate experimental components of their program. And so if they have got their outcomes they're interested in, trying to include abstinence and trying to reduce frequency of use. And then they have the types of components or things like the type of facilitator who will be, delivering the intervention. And those are very different cost models for a peer or licensed clinician. Presence or absence of critical dialogue, quality of life wheel, and capacity building. So these are some of the things they said, we really want to put all of these in, but we might not be able to put all of these in. How are we going to decide on this? And so the reason why I'm including this example here is because the approach itself allows a bit more planning. These components came in to their intervention because of the group that they were working with, its advisory group. And then they're going to work with their advisory group to select the final ones. And they're also going to apply some criteria about trying to keep the costs down. So they have a lot of ambitious goals, and I think they really nicely characterize the work. This is the conceptual model they have, where you can see there's like critical dialogue has its own pathway about how they think it's going to reduce the frequency of substance use, quality of life wheel, capacity ability. So all these things are like, do we throw them all in or not? And how do we make that decision? So this is how they've sort of organized their thinking. And then this advisory board were people who were participants who were alcohol, drug use involved individuals, also people from the nearby. They described it as distressed communities with large concentrations of African Americans, service providers, and the study team. So all of the components went through process of selection with this board, and this sort of describes the details of how this NCCB board did this work. All right, now I'm going to turn to the second area that I think is where there's really a lot of emerging work. And this is where I think if you can identify some people who are doing work in this space, it might be really interesting to learn how you can apply it to your work. So this is where you're sort of not embedding equity into implementation science or into any research structure. You're actually trying to think how to reorganize the research structure from the get-go. And so that's the kind of thing that we often aspire to do. And so how does that actually start to get happening? So this is, I guess I'd say there's interesting articles that talk about this first approach. The equity can be integrated, as I just went through those examples, is somewhat agnostic to sort of like racial injustice or large structural determinants. And the second approach is putting that in the forefront and trying to address it more directly. Okay, so here's some of the things that I think would be interesting for you to read more on, and here's a few references, but there's quite a lot in the associated reference guide that Andrew Kirchhoff put together. So questioning the evidence base and its origins from an equity lens. So this is getting to the peanut grinder example, like who gets to make the evidence and what's inequitable about it. Applying a race-conscious frame to the use of implementation science tools. I'm going to give some examples of that. We all want to tackle upstream structural and social determinants, so this is never going to go away. That this is an important area to sort of forefront if we have an opportunity to do intervention work that's a little bit more comprehensive. Sharing power and decision-making, building better teams. This is something that we can do without having to get our large grants funded, and using community engaged and participatory methods throughout. So not just sort of in the formative work, as I've alluded to. So some of the things that I think are interesting in this space too are this idea of questioning and revising the evidence base. So I think this is where doing the formative work about what is the evidence for solving a particular kind of problem, who has lived experience of this, who can help in the evidence building phases to really understand what is the information about what might work that is from the perspectives of people who are going through it, not only from those who are doing their own assessments of what success looks like. So I think this is where the idea of using more sociologic and anthropologic approaches to have more experiential input and trying to use that to organize intervention development is a new strategy for implementation science. I think we often are in the anthropologic space, maybe to augment things that we already think are going to be interventions, and this would be a little bit more challenging of that to develop in the first place. And so again, the participatory methods really are about developing questions, are about developing instruments for data collection, are about sampling, are about data analysis. So these are broader than formative work. And I think this idea of using an implementation science question approach that reflects social justice framing and racism conscious approach. And that's what the examples I'm going to talk about for some recent work in this area. So applying a racism conscious approach to use of implementation science methods, this again is I think this idea of co-design, and we don't have like great examples on how do you actually set up a structure for co-design. So not saying this with deep knowledge of this, but I will refer you to this really interesting article by Allen et al., a racism conscious adaptation of CFIR. I'm going to give that as an example too, but I think it does talk about some really interesting approaches about how to design in a context of an intervention that is in this case, they were putting it into a public education setting. So the things that might focus on equity can be co-developing intervention that addresses racism directly, expanding implementation measures to address racism as a specific component. So it's not a driver or a determinant, but actually one of the things that you're looking at in your process approaches to understanding what is happening in the implementation process, and adapting interventions to apply race conscious frame for the logic of the intervention. So the intervention then taking into account maybe those other theoretical approaches that are more experiential in order to improve the way that an intervention logic might approach a topic like racism. And another approach is this idea of tackling the upstream determinants and structural determinants. And I think this is where there has been some exciting work where people are able to get access to big data and do policy analyses and then try to align interventions along with policy changes that are happening. So this is sort of where I think there's been more sort of responsiveness to policy when there is has sort of on the heels of analytic approaches that have highlighted disparities that are in policies in place. And I'm thinking, for example, of things that are in healthcare delivery around algorithms that have been identified as racist, and are there ways of your intervention aligning policy changes or saying that we're not going to allow certain kinds of healthcare algorithms to be implemented. So those are some of the things that I think are at least helping us move a little bit more on upstream. Like we talked about earlier in this, sort of thinking about the power and decision-making with examples of, for example, advisory boards that are not only in the formative phases, but really thinking through how you can establish decision-making protocols that are equitable. So it's not just that people are in the room, but there's a process to ensure that there is decision-making equity. This is something I think there's probably not a lot of work on, but maybe people have examples of this. I'd be really interested in seeing those. So are there also opportunities to have oversight advisory groups to look at best practices? Maybe there are particular approaches to an intervention that you want to ensure are equitable. And so you have an advisory group specifically with oversight for that particular element of your intervention or implementation. And I think the idea of applying participatory methods, number 5, in new ways to address power dynamics is another thing that hasn't really been that well described in that article I was mentioning, the racism and CFIR analysis. They talk about some particular elements of how their research team looked at stakeholder engagement and looked at decision making and made some real-time adjustments in settings that they felt were not being responsive to people who were underrepresented in the study team. Okay, so let's just dive in a little bit more to questioning and revising the evidence base. This is a tool that I think I would love to see a little more work on, but many of us use interviews, qualitative interviews, to understand barriers and enablers. And this article by Etherington tries to take one of those approaches that we've used, a theoretical domains framework, relates to the implementation model, COMBI and behavior change wheel, which several people like to use because it helps plan out after you understand barriers. This is really trying to improve the quality of questioning that we do in those open-ended interviews with semi-guided prompts for how we conduct those interviews. So this is really trying to get a sense, and I'll show the second slide of the social context for somebody where you're wondering how it is that their role around an intervention could potentially be improved. Maybe you want them to screen more. Maybe you want to understand how counseling is occurring in a particular setting. This may be healthcare specific in this example, but not in general. so this is asking about identity and how someone's perspective on their own position or identity within a group, a little bit more than we tend to glean from in-depth interviews, is a little more direct. So trying to understand how groups they belong to might have experience benefits or challenges. So this could be understanding how people may have experienced racism or ableism or other kinds of inequities, and how that might impact how they do their work and how they see their role. So this is the kind of thing I think that being more explicit in our frameworks will help change the evidence base if we are thinking that this is the way we need to understand the setting in which we want to develop an intervention. So this is nice from this paper too. They talk about some of the specific domains that are focused on in these frameworks, and they sort of turn them around and say, well, you know, we can ask about social capital, we can ask about social identity, but we really need to think about the intersectionality of that, and we need to develop a way of understanding how that may need to be addressed in interventions or leveraged if there's strong positive identities that are part of a person's engagement in their environment. Now I'm going to talk about the CFIR example that I was just mentioning. So CFIR is a consolidated framework for implementation research. It's an organizing, a theory-based approach to evaluating intervention implementation. So some frameworks are about how you design interventions, others are, you know, how to evaluate them. There's lots more ways of thinking about it than that, but we'll just say that this is one about how do you understand intervention implementation. And so the idea, back to this idea of agnostic, it is was meant to be made general enough that you could adapt it to different implementation contexts. And so it is based on a lot of different theories that have been reviewed and have been successful in their approaches to implementation, and then combining them across. So a lot of implementation science has done this sort of, we've done this distillation, we've combined across, we've come up with a tool that you can use in a lot of different settings. And so that's like, I think the field is really advanced, you know, early on in that space. So now it's sort of coming back to correct, like course correct, I think a little bit like, well, maybe that guiding framework that's agnostic to very big drivers that are right in front of us around inequity, maybe we need to confront that and challenge these frameworks and make sure that each of the aspects of them, in this case, in this example, are looked at through a race-conscious lens. And so this is one of the ways in which I think, like, if you read this as a case study, it really sort of challenges both the sort of dominant paradigm of agnostic to some of these forefronted inequities, but also like, well, then what do you do about it? How do you study that? And how do you understand what might redirect for that? So I think it's a really great story for that. So they took a public health critical race praxis approach to adapt CFIR to the particular setting that they were working in to really understand how structural racism might interact with their intervention. And so they were looking at a school-based intervention to promote connectedness. It was also to address racism. And they wanted to understand its effectiveness, and they wanted to look at facilitators and barriers for predominantly by BIPOC population, and they were very interested in using the CFIR model. But first they did an analysis with this kind of race neutral application, and then they used one where they have their results again analyzed using the public health critical race practice approach. So I thought it was really nice to sort of see how they compared those. So this is just a little bit of a excerpt from one of their tables. And I just want to draw attention to something like in the CFIR domain, we think about, you know, social structural characteristics. So that might be how the school context and social organizations are set up. How did race, ethnicity of the school leaders interact with their program, which was called Trust. But then they started looking at some of the ways that finding might really be different. You know, we experience this all the time. You know, leadership turnover significantly affects intervention uptake. Okay, so they found that in their initial analysis, but they also found that the fact that a person of color was the leader, that really influenced more significantly uptake of the intervention or engagement with the intervention. So they were able to sort of tease out like that disproportionate aspect of how implementation was affected by using this different analytic approach to incorporate racism and racist thinking into the way they analyze their data. So I'm not going to go through all of these. I just want to say this was a pretty comprehensive analysis for which I really like it when you can kind of compare one approach to another with this level of concrete information. So I think this is a good example of work that is sort of shifting the paradigm a little bit in this space. So that's my last sort of developed example slide. So I think just to leave some time for us to talk about this too, the idea that implementation science can improve its focus on equity, I think that goes without saying. There are many approaches in this space to doing that. But I think that the idea of incorporating into the work we're already doing, there's a lot of already great examples of that. But I think this developing new approaches space is really worth a lot more kind of attention, and I think, conversations about what are the methods that can really speak to rethinking how research is approached in the first place. So just to sort of give you a little bit more orientation, I think I mentioned there are these resources that are associated with this talk. And also, if you're interested in implementation science training program at UCSF, it has a new focus on health equity. And so the directors of that program, Drs. Maria Garcia and Priya Shetty, have been focusing on trying to embed more health equity into the course curriculums and working with the course directors. Also, Drs. Jen Veloza and Andrew Kirchhoff have been working very diligently with those who teach in that program. So I think just want to shout out, that's a really nice area of new work. That's it.
Wow. Thank you. That was a tour de force on everything we need to be thinking about as we really incorporate the health equity lens into our work. So thank you. I want to open up the floor for questions. People are welcome to raise their hands or actually, I don't know if I'm going to be able to see everyone's hands because there's so many people on this call, or throw a question into the chat, or just come off of mute. Maybe we'll see that you're there ready to ask a question. Well, I guess since I don't see anything popping up on screen just yet, and Rochelle, if you can keep your eye out, that would be great. I am wondering, Margaret, as you dig deep into this topic, like what you're seeing in terms of the funders, is there interest at NIH, at some of the foundations, like where is this, the research that really takes this health equity lens and not just sort of tries to include some of the things that have become expected in our research, like having a community advisory board, but like really changing the approach and the design that you were talking about? Have we seen receptivity at the funding for the NIH and for other funders to really change the approach that's happening here?
Well, I think I don't know that much about like recent funding initiatives, but I know that like the first sort of pathway that I was talking about adding more equity or positioning it more directly into the work, there is a lot more work that's funded in that space. So I think that's sort of like the safe add-on or integration, or maybe, an AIM is now completely funded to do participatory data analysis. And in the past, the funding had been for the community advisory board. So I think sort of like those shifts are natural and are a bit more incremental, but at the same time, they may be very radical for a funding agency to say, we're actually going to allow this amount of time and funding to do something like participatory data analysis and intervention selection. So I think that that ambiguity about not having everything decided when you start your research study is still a tension for funding. So if you say, well, we're going to do this great qualitative work and then we're going to decide, that's a little harder to get funded, continues to be harder to get funded. And if you then say we're going to do it in partnership, I think it's not that it's not a good idea. I think it's just there aren't a lot of kind of coherent research funding mechanisms for that. So I'll just say that I think there's a lot of work to do in that space.
Yeah, I appreciate that response. I think we're always struggling with the sort of how much do we dictate and sort of pre-specify and how much gets really created by that partnership.
Yeah. I mean, I'd look to see like that example I gave of the most trial would be interesting to see, maybe it's NIAID that focused, funded it, or I forgot which was the Institute on not allergy and infectious disease, the one on substance use. That one to me, because they presented it as a most trial, they've sort of concretized options. So it's not like, oh, we're going to work with people and decide on the options. They already sort of done that pre-work, which probably was done in conversation with partners, not just separately. So, you sometimes you see the study in the protocol, but could have been 2 years of, work that was done ahead of time to get to that point where you can be that concrete. So I think there's a lot of work that doesn't show in some of the research finding presentations.
Yeah. Wayne, I see you're off mute.
Yeah, there's a couple of questions that are popping up in the chat. So I just want to.
Okay, do you want me to look at those? Okay.
Yeah, I mean, maybe we'll do. So we've got one from Willie and one from Jackie. It looks like Jackie's is a follow-up on what we were just talking about. So maybe we'll start there and then go to Willie's. And what's being asked is this question about if you include some of the health equity approaches, you're often talking about increasing your expenses. And then that means, especially as a new investigator where you may not be able to ask for an extra large budget, that you have to give up something else. So there's this tension that comes in that, and kind of how you resolve that tension or kind of work through it when you're trying to write a grant.
Yeah, no, I wish I had a nice answer to that, because it's a more than a tension. It's like a problem. It's like a issue of how funding happens. I mean, intervention research itself is not funded with more money than things that are observational. So like just that in itself exists, and then you're working in a intervention space where you might have strategy A versus strategy B. Well, each of those are delivered. They're not a control group. So each aspect that you do to increase, in a way, the relevance and timeliness of your results in the intervention implementation space does cost more money. And it just gets very difficult to even just put different interventions against each other and study that without any participatory or community processes involved. So I think the idea of trying to embed it all the way across can be done strategically by having advisory groups that you meet with for different things over different time. Maybe you don't put as much funding into qualitative interviews over each phase of your research just to save on funding, but you have an advisory group that you present with for different aspects of your work. And that may be a way of including an engagement process, but cutting costs. And of course, it depends on the work you're doing and the community stakeholders you're involved in. I know I just worked on a proposal that was an R01, and we asked for over the cap for the intervention that we were proposing because of the participatory nature of the work, and that we were comparing different strategies. And, we got a very good score, and we're experienced investigators, but it's like, there needs to be that approach, I think, for the extra funding for early career investigators that are doing that kind of work. And there just really isn't, I think, attention to the fact that each thing you do adds a lot more work, both the intervention development, the comparison of strategies, and the participatory methods. So I don't have an answer. I just increasingly am surprised that people are trying to pack in more efficiently.
Yeah.
And then Willie notes that he just says he appreciates the work that's happening and curious to learn about the equity focused training program and learn how that work is going to unfold and see what it yields down the road. So a little bit of a comment, but I don't know if there's anything you want to add to what you mentioned about that program.
Yeah, no, just to reach out to those people. They're all at UCSF, and it's sort of a new initiative within the training program to standardize. And I think this is something that Jen Veloza did previously when she was at University of Washington. So she may be a good person too to contact about that. But yeah, for sure, Drs. Chete and Garcia have spearheaded this initiative, which is underway, and I'm excited about it.
So Margaret, I was wondering, since you mentioned this, or at least I mentioned it in my introduction, that you're now looking at how to apply this equity lens for things like climate change. I was just wondering if you could give us like a little snapshot of how you're doing that and what the work entails.
I'm really kind of in a
Another
early
lecture.
stage. Yeah, no, I'm in a very early stage of it. And I guess one of the things that I'll just say that I'm trying to do is, there's so much amazing work in environmental justice. And, I studied environmental science and have done a lot of work on environmental toxins, but really sort of how do we, for example, maybe not use an implementation science approach, but like if I can create something from scratch, maybe I would start with an environmental justice approach and think about what are the interventions that would come into that space and how that would then be informed and improved by implementation science, as opposed to a method where I might say, here's my really neat implementation science curriculum that I have, or my approaches, and I'm going to now tackle a topic like heat buffering or heat what do you call it, like overwhelmedness and inequities in that space. Thinking about we know there's many inequities in access to climate interventions, all the way from electric cars to solar energy to who can afford to be late for work if they have a bus pass, and who can't, and so there's just a lot of things that are perhaps of interest to look at, not just from the implementation space. So that I'm trying to allow myself to think that way, and doing reading in another area. I'm always sort of feeling like I should be drawn back to the work that I'm supposed to be doing, but I'm trying to give myself some space to think differently about it. So if anybody has any suggestions, I'm open to it. So I have this project underway that is really just started, but I'm back and forth in immersion in it. So open to ideas.
Yeah. Yeah. I mean, it sounds honestly exciting to be able to sort of start, maybe you have all these frameworks in your mind, but you can set them aside long enough to ask the questions in the community about sort of new places to start, as opposed to trying to shoehorn something into a bunch of tools we already have.
Yeah, and I do have a stakeholder process that I'm starting. I'm really excited. One of my colleagues at UCSF is speaks the language of Croatian, where I'm doing this work. And so we're going to do some stakeholder interviews that are sort of outside the traditional public health academic spaces that I have contacts and connections to. So I'm excited to learn.
Great. Well, when that Fulbright's over, we'll have you come back and talk about how that played out. We have just a couple minutes. If anyone has a question they want to throw up in the chat, or raise your hand, or just start talking, because I can't see everybody on one screen since there's so many folks here. Or if not, we can let everyone go 5 minutes early to go see what's happening in that World Cup game. Don't tell us.
I almost wore my Croatia hat, but
yeah,
putting it out there.
Okay, well, it sounds like I think you gave everyone a lot to think about. I really appreciate that talk, and we'll be going to look at the, it's halftime apparently. We'll be going to look at all the resources that you put into that presentation. Thank you so much. And as Rochelle said, we'll put that up on our website and the YouTube channel in about 7 to 10 days. So
I'll say you might want to have a journal club or something, in those spaces, because I think there's some really, might be really interesting to do something like that for your group.
Absolutely. Thank you. All right. Well, thanks again. Thanks, everyone. And make sure you get your snack before the second half starts.
All right. Thanks.